There's been a trend that hasn't really been tracked, but there are a series of incidences that have occurred that involve urologists all commonly. And through those separate incidences, there are common threads through those incidences. What is uncommon and very rare is the fact that there have been five urologists who have been assaulted with a gun and shot by their patients. Now, every story is different in regards to the patient stories and the histories, but what our common threads are, things that we can learn from and try to figure out and understand what is this a trend? Is this something we need to actually look closely at? And what it came down to was really in my own institution at Kaiser Permanente, we have had actually 2 urologists who have been shot and survived. But since that time, there have been 3 more that have outside of Kaiser in the private practice setting. So we ask ourselves the question: is this something that we really need to take a close look at? And ask the question fundamentally is: are we in a specialty that actually requires us to really be sensitive to the patient encounter more so than maybe other specialties? And so everybody has an opinion about it, as far as that's concerned. When you look at the data and literature, when you look at the OSHA literature or things from the Bureau of Labor and Statistics, there's generalizations that are made in terms of what the tracking the violence in healthcare, but there haven't been specialty specific in regards to really breaking it down that way, as far as that's concerned. But the numbers are really compelling. I mean, I was really surprised when I started this journey about awareness to look at actually that more than almost 60% of all workplace violent encounters involved healthcare workers. And so this is really something I think in the future, to give you a backdrop with all the things that are going on with coverage and reimbursement, as well as patient billing, as well as wait times and that sort of thing. Patients are actually, I think, getting to that level where the encounter between the provider and the patient are going to be challenged even further with some of these external pressures.